Can you talk about where we are in relation to that?
Well, we're at 19 cases right now that almost all of them we can link to travel. We're not seeing increased utilization of our healthcare system, increased visits with respiratory illness. So we are still working in the containment phase of this outbreak. But we have been planning for mitigation steps all along. And in fact, we've implemented mitigation strategies, right? The social distancing strategies aren't used in containment. They're used in when we see community-based transmission. And so we have implemented those before we've had evidence of this, right? So we don't usually suspend schools or or childcare until we see sustained community-based transmission. None of which we saw. So we are ahead of this, and we're hoping that that's going to really allow us to flatten that curve. We will see community-based transmission here in Manitoba, but we're going to hope to limit the impact.
And I just wanted to follow up on the 3 doctors who were at the Bonspiel, and I believe it was Edmonton. Are there any updates on them?
I don't have specific updates on individuals. No.
So those cases haven't been confirmed, or?
I wouldn't comment on specific individuals.
I just wanted to just to clarify one last point. You said we will see community transmission. We want to limit the spread. Am I reading that correctly? Like it's kind of inevitable at this point.
I think if you look at it in the in other jurisdictions, we're going to do what we can to contain it. Right, so we certainly have not given up our containment phase, but the more and more you see this virus introduced into your region, the more likely you're going to see community-based transmission. So we are definitely prepared to see that at all levels of the healthcare system, and I think we need to anticipate that.
So do you have any information about at what point those doctors self-isolated? Was it immediately when they returned, or when their colleague in Saskatchewan was tested positive?
I don't have information on individuals here like that. So
just in terms of the resources we have for healthcare staff here, if their tests are negative, are they immediately cleared to go back to work?
No. So if you are a close contact to infected case, or if you are a returned international traveler, the incubation period is 14 days. So even if you showed symptoms and tested negative, say another type of respiratory illness, that does nothing to change your incubation period. You could be still incubating that virus. So negative tests don't get you out of an incubation period.
Do you know what specialties they practiced in?
No, I don't have information.
We've heard people saying that. I believe it was the day they were at the Bonspiel was the day that the new coronavirus was declared a pandemic by the World Health Organization. At that point, we were pretty far into this thing. Do you think they should have known better than to go to something like that, where there were going to be so many people?
And again, I think this is this is that time for Manitobans to be working together to implement these things. So I mentioned that all of our cases are from returning travelers. That's in no way to put blame on them. Right? We're working together they presented for testing, they were self-isolating, and so I'm not here to judge people's actions. I'm here to try to inform them properly. So I wouldn't be in a position to make a statement like that about whether they should have been there or not.
That's it. All right, thanks everyone.
Thanks, guys.
I didn't stay on my